Let me try this. So sorry to interrupt your train of thought.
Thank you, Amy, for starting the recording after all my comments. That's really helpful. What I was saying was in a thumbnail, I know that this COVID-19 has been disruptive on a health scale and on a societal scale as far as economics, and people are anxious to get back to normal. I was saying I don't want us to get lulled into a false sense of security that just a few weeks ago, the new cases of COVID-19 or the cumulative total cases was doubling between every 3 and 4 days. And if that had continued, we'd be in the thousands or tens of thousands of cases right now. And, you know, every medical person I'm talking with and all the things that I'm reading, you know, people are suggesting we would be lucky if this has actually impacted 20% of our population. Now, we do believe up to 20% have had it, but we believe there's a significant number of people who've had it and have been asymptomatic. No symptoms or so mildly symptomatic that, you know, we just don't know about them. And of course, I wish everyone had had it and not known about it. But if it's only 20%, there's still 80% of the people out there that's not had this. And while a lot of people are going to be okay, a lot of people won't be. And we have seen in states and nations that didn't take the precautions that Kentucky has, that you know, you've seen the hospitals overwhelmed, and you've seen people having to stay home and die or being left out in the hallways to die. And that's, you know, that's really what we've, from a public health perspective, have been trying to avoid. We've never felt like we could contain this disease because, you know, you catch it and you're spreading it before you even know you have it. So it's really difficult to get ahead of it. So we've been trying to mitigate it. And the goal of that mitigation is slow it to the point it doesn't overwhelm the hospitals. Now, obviously, you know, we would be dealing with this thing for 80 years if it just kept trickling in like it's trickling in now. Either a vaccine has to be developed, or you have to let society start happening again, the economy start happening again, and start letting it spread and letting it work its way through society. But you just don't want it to get to the point where the hospitals and things are overwhelmed. So as we're thinking about rolling up businesses, you know, the big thing that we're trying to avoid is excuse me, is social gatherings, especially in places where people are going to be for an extended period of, my computer is backing up. Sorry, for an extended period of time in a small space. We were just talking about churches a few minutes ago, how that's just the perfect location for this thing to spread, where you get a bunch of people in one room for an hour and they're very close together and sharing the same air. And you know, it can happen in a business too. We saw this a significant outbreak of this disease occur in one of the churches here. One of its members worked at a factory. It got into the factory. It shut the factory down. And there was a significant number of cases in that factory. Now, over the last 3 or 4 weeks, as things have slowed down, as far as the economy-wise, the shutdown, the social distancing, and all that, we've seen it slow. But, you know, we expect as the economy opens back up, it'll start spreading again. And we just hope that with the, you know, avoiding social gatherings, covering your cough, trying to stay away from people, 6 feet away from people if you can, wearing your mask, so that'll at least slow it down enough to where it don't spread so quickly that it overwhelms the hospital. So I'll just stop with that as far as introductions, and we'll see where the conversation goes from here. Thank you all for joining us.
Okay, I'm going to ask Stuart to take over some of the talk and give you all some of the guidelines. I will share my screen at some point if he's ready and gives me a cue. I'll show you the Healthy at Work page if you haven't seen that or been aware of it. And there's also the Kentucky COVID-19 page that has good information from the state. So I'm going to let Stuart have his turn talking.
I'm just going to go ahead and start out with the Healthy at Work page because that's where we want to direct everybody to. So I'm going to have Amy bring that screen up there. And while she's doing that, I'm going to go ahead and just kind of start talking about a few of these things that you guys it's been out for a while, so you know that. The phase 1 reopening on May the 11th, so Monday, that includes the manufacturing, distribution, supply chain businesses, construction, our car, boat dealerships, any office-based business, so like an attorney or an accountant, they can come back at 50%. Horse racing, and this does include automobile racing, that is allowed as of Monday, but with no fans. So they can do that. Some pet care, grooming, boarding, and photography. Now, they have to open under certain guidelines. And one of those things is if they can get the PPE. So there's masking requirements as of Monday for all businesses. As you know, there's been businesses that have been open that are essential businesses, but now they're going to be required to mask as of Monday. There's some hand sanitizer requirements. So if you can't get the PPE, then you can't open. But everybody should be able to get this PPE. There are links that were provided on the governor's, I think there'll be some links here. I'm not exactly sure where they're at to get if you need to get some hand sanitizer, the distilleries have made that, and I believe that's plentiful, and they can supply that. Cloth face mask, homemade face mask, that those are okay. And Amy's scrolling right there at the minimum requirements, and I see that it's not working right now, but I looked at it just a little bit earlier and was able to pull that up. And that does have all the requirements for PPE there in that link.
Well, let me do it.
Try again, but it's not working. And I think that's okay, Amy. On the
Something else.
Okay.
Go ahead.
Just going to try that. When we get back to that on our right-hand side of the screen, we'll see where it actually has all the requirements and guidelines for the industries that are going to open. We've been told by the governor's office that they will try and get, for each thing that opens, they're going to try and get that out to us about a week in advance. So on May 20th, we have the retail stores. Those are forward-facing stores. So when I say that, what I mean is malls are not yet open, flea markets are not yet open, but businesses that, retail business that, like in a strip mall where you enter into those will be allowed to open. We do not have the guidance on what kind of capacity there'll be yet. We're still on that, should have it about a week before they're ready to open. Same for the churches. On the 25th, he said that all our cosmetology related businesses can open. So barbershops, beauty shops, places like that, the nail places, tattoo parlors and massage therapy, they'll be able to open on those dates with guidance to come. Now, cosmetology already has their guidance out there. You can visit the Kentucky Board of Cosmetology and pull that up, and it's some really good guidance. On May 22nd, restaurants are going to be allowed to open to inside dining at 33% capacity. So there'll be some guidance that'll come along on how to do that. We do have some ideas here that maybe a restaurant would be able to block off 2/3 of their parking lot to no parking, but outdoor seating is allowed. There's no maximum on that as long as they can be spaced out. So outdoor seating would be allowed, so restaurants may be able to do some additional seating outside. June the 1st, we have movie theaters and fitness centers that can open. On June the 11th, campgrounds, this is mainly referring to state campgrounds. And on June 15th, childcare and youth sports that are low touch and outdoors. So things like tennis, probably baseball would be able to open. And then the phase 3 openings, as far as bars and groups of 50 people, that comes around in July. Of course, on the 25th, there are the 10-person social gatherings also that will be allowed. Again, I don't have the guidance on all this. They put it out about a week before the opening. I do have the guidance on the first things that we talked about that are part of the phase 1 reopening. I do have those, but I do not have the guidance on phase 2 reopening. So the things that can open Monday, May the 11th, I have that. Anything beyond the 11th, we don't have that yet. And we usually, we find out about the same time that the public finds out. So if you'll keep an eye on the governor's daily conference call, and if you will keep an eye on the Healthy at Work website, then you will know the guidance as soon as I get to know the guidance. So the only difference is we have to enforce the guidance, so we have to do a little bit of interpretation, and we use the cabinet's legal services for any interpretation to make sure that's in line with what the governor wants to happen. You know, we can't list every single type of business out there, so there has to be some interpretation, just like on horse racing. Well, that does include auto racing, so that's just an example. And I'll open it up. I think if anybody has specific questions, we can talk about those, and I'll try to help you as best I can through those with the guidance that I have. So especially if we're talking about May the 11th stuff, I can help you on that. If we get beyond that, then we're speculating. So.
And I want to say too that we have spoken to Kristen in Taylor County. Before she even had reached out to us, we had actually thought of doing this type of a Zoom meeting with all of you all, with the leadership of the chambers, to kind of get your questions and your interest and see what information we could share that would help you and your local businesses. And then Kristen reached out to us and had asked us to do a Zoom meeting with the Taylor County Chamber members. And we told her, yes, we would certainly be willing to do that. And we can offer that to all of our counties. That would be 10 different Zoom meetings and 10 different meetings, but we're willing to do that if that's something that you all think would be beneficial to your businesses and your local people. That would give them a chance to ask us questions, get specific guidance and things, you know, and be a local resource for them. So we're certainly willing to do that. Just reach out to me or Stuart and let us know, and we'll get that scheduled for you.
There's a question about screen printing in the chat.
I have that. I believe that screen printing, again, this is not, well, I actually believe that, yes, that we can open that on May the 11th under the manufacturer distribution. Screen printing businesses are more of an in-house. Now, what they probably may need to do is try and limit their orders to phone call orders until the retail would be allowed to open on May 20th. So they could go back in making the shirts on the 11th, and then on the 20th, they would be able to open up their retail, if they have a retail store that they sell the shirts out of, and then for their customers to come in and place orders, that would be May the 20th. So there's actually two aspects to a business like that, and I'm not certain what this screen printing company, how they operate, but we could, you know, we can talk to anybody one-on-one as time permits, of course, if they have some specific questions. So,
Sir, when you're saying something will open, that doesn't mean necessarily it's opening as it has been in the past. It'll be open with restrictions.
That's correct. That's correct. So just like the May the 11th openings, there's restrictions on those. So will be the rest of the openings as we move along, whether it be a retail store or a restaurant. Those things will have restrictions in place also. So if you'll see some of the requirements. So just for example, let's just make an example of a place and talk about, let's see, let me pull one out here. So on manufacturing, distribution, and supply chain businesses. So they have to ensure that their employees are able to distance 6 feet. Sometimes in a manufacturing setting, they can't. So there has to be some engineering controls put in place. What that means is they're going to have to do some barriers or high efficiency air filters, and we can speak with them about that. They need to stagger their work schedules. They have to basically close down their break rooms, any place where people would gather. They can't use the time clocks anymore, I think was one of the things. So high touch surface, they need to eliminate those high touch surfaces. They have to put in place extra cleaning. Let's see what else I have down here. They also have to meet the minimum requirements of the hand sanitizer, hand wash stations, and the masking requirements. They have to try and ensure that there's minimal interaction between like loading dock drivers. So as you see, there's a lot of, for everything, there's going to be a set of requirements that they have to follow. So that will come through also, again, like I say, for the retail stores and for the restaurants, the same as it has is for the auto dealerships, manufacturing, things that can open on the 11th. So I know that was a long answer to that question, Shirley.
All right, I'm going to give you all the opportunity to unmute. Kristen, Sherry, Ellen, I think you all are the 3 chambers that are on, unless someone has joined that I haven't noticed. But if you all have specific questions or things that we can help you with or concerns, go ahead and unmute and feel free to ask.
Yes, this is Ellen Zorns in Columbia, Dare Chamber of Commerce. I have a question about, with all the reopenings, if they don't meet the minimum requirements, what are we supposed to do? Or are we supposed to do anything?
Ellen, if they can't meet the minimum requirements, then per the governor's orders, then they're not ready to open yet. So if they, go ahead.
Oh, I'm sorry. I mean, if they open and we find out that they aren't meeting those requirements, do we contact the health department and let them know? Or, I mean, how does that happen?
Yeah, you can contact us. It can go up through, there's a hotline, but that hotline comes right back to us. So, I mean, you can contact at the health department and we'll be able to check on that. We feel like we're going to have to prioritize our complaints because just in Adair County, for instance, there's one of us, there's Corey, and Corey, you know, if we have, as these complaints roll in, there's one of Corey, so he'll have to do some prioritizing in how he investigates those.
Okay, and hopefully we're not going to have any, but I know that's a question that we're going to be asked. Okay, thank you.
Okay, and customers, so the people who come in, now a store, a business, by the governor's rules, they can exclude somebody who is not wearing a mask if they so choose to do that. Now, the customers, the general public, they have been strongly recommended to wear masks, and we strongly recommend people to wear masks. Sean made the comments earlier about this. You know, we hope that there's not a resurgence of this as things start opening up, but there very well could be. There's a lot of people out there that are asymptomatic, and I'll tell you, if you end up getting it, I mean, you may get lucky and be one of the people that it doesn't affect, but you may not be and be one of the people that spends 2 weeks at home sick with a high fever, or you're sitting in the hospital on a ventilator. So we don't want to see that happen to people. I mean, even myself, you know, I feel like I'm fairly healthy. I feel like I'm young, but I know that I'm not that young anymore. And whenever I see myself on these things, I put on my gray. So, you know, I want to be careful myself. I don't want to take a chance. I don't know how it would affect me, and I don't want to take it home to my wife or the kids. So,
And, you know, and when this was doubling every 3 to 4 days, we'll just say 3 days, but, you know, one person, you know, when in 3 days that became 2 people, then 4 people, then 8 people, then 16 people, then 32 people in 5 weeks. So one person was spreading it that far in 5 weeks. Of those 32 people, it's very likely a few of those were in the high risk group who would have been very likely to have to be hospitalized or maybe even pass away. So, you know, while our case rate in our district has been better than state averages, and the state averages have been better than national averages, our mortality rate has not been better than state averages. Our mortality rate is considerably higher, and then maybe that's because it got deeper into some of our nursing homes than it did in other places. But you know, it's still, like I said, maybe there's 20% of the population that's had this, and still 80% of the people susceptible, still probably about a year away from a vaccine. It's still got a lot of room to spread. So I know, you know, I keep saying this, but I feel like people have been lured into a false sense of security and feel like it's not, you know, here we've done all this stuff and nothing's happened. Well, nothing's happened because we've done all this stuff. You know, it's hard to convince people. But if you look at the news, basically the entire world instituted some form of social distancing. And in the entire world for the last few weeks, you've seen it go from doubling every 3 or 4 days now to, you know, doubling much longer. That's because they've done those things, and, you know, everybody's starting to loosen things back up now. So it'll ramp up some as we go through this.
Okay, I have a follow-up to that, to my question. This is Ellen again. If we have somebody come into a store that's not wearing a mask and they're asked to wear a mask and they refuse, what do we do then? What does the retailer do then?
If they refuse, then the retailer needs to call law enforcement, because
Okay.
You know, they've asked them, they're allowed to ask them not to do that, and if they won't remove themselves from that property, then they may need the police to remove them for them. Now, in a case like that, you can't call the health department and expect us to. Even though we are enforcement officers, we can't arrest people, and generally we don't carry guns and want to. We don't. We're not interested in altercations. I can tell you that.
We're enforcement in the sense of we're enforcing regulations and we're enforcing rules on businesses. We're not individual enforcement officers with arrest powers and powers to find people. So that's where the law enforcement.
Okay, and I thought that was probably the case, but I'd had a couple of people that asked, and I said we'd find out for sure. Okay, thank you.
You're welcome.
And I think you probably want to encourage your retailers to take safety measures, you know, and think about those types of issues beforehand and reach out to your community partners, your law enforcement and stuff, and build those relationships and get their opinions on things and kind of know where everyone stands. Because, you know, we've all seen national news and the horror stories and things that are going on in other places where things are opening and this very thing happens, and violence and all sorts of things. So we don't want that to happen locally to any of our businesses and partners. So the more things we can do on the front end of this, you know, before we open and have issues, the better off it'll be.
A lot of people are amped up and emotional about this, and you can understand that. So I think Kristen's been trying to ask something for a long time. She looks like she's opened her mouth like 6 times and being cut off.
No, it's okay. No, actually, I had the same question she did, especially about the, compliance and monitoring that. So I know that's going to be a concern. Is that something that, if someone needed to report it, would they, let's say a customer goes in somewhere and they see, hopefully it won't be the case, but if they were to see a large group somewhere, and obviously didn't need to be, would they report it to, what would be that process?
Okay, so on something like that, probably you're going to need to be able to report it to both the health department and the law enforcement, because if you have a crowd gathering, again, like I say, we're not enforcement in the sense of being able to disperse that crowd. When we talk about our enforcement capacity, it's more on the business itself. So if a business was non-compliant, that's where we do our enforcement in. On individuals who are non-compliant, that's going to go more to law enforcement. So.
Okay. Do you, and I know if we all had a crystal ball, it would make this whole process a lot easier. So let's just say, do you have any thoughts on a possible resurgence this fall, as with some other medical conditions like the flu? Do you foresee that?
Well, it's like I said, it's probably burned its way through about 20% of the society right now. 80% is a whole lot of people left to go. We have a population in Lake Cumberland of about, let's say, just 200,000. So, that's about 4,000 people that we think may have had it now, and a whole lot of people left to go.
Yeah.
And, we don't see any indication that it's slowing down anywhere based on, the time of year or the weather or things like that. I've not read anything suggesting it's going to slow for the summer, and, who knows, maybe it will. I hope it does, but we expect it's going to pick up, and it'll continue to pick up. And of course, when we get to the fall and you get into your regular flu season, flu and cold season, that'll complicate things even further.
And I can tell you from a planning perspective, we're certainly planning for eventualities like that. We look ahead and try to think of all the what ifs and the worst case scenarios. So we're definitely not letting up on our planning efforts, any eventuality that something should happen. And hospitals are the same way. Healthcare providers are all looking ahead and hoping it doesn't happen, but planning for the fact that it might.
So during this pause that we've had, that the whole, the nation and the world's had, while we've had this pause, then it gave us a good opportunity to be able to ramp up production of some PPE and things like that. So as we get back to work, we definitely, everybody hopes it's not the case, but logic tells us that this is not going away. We're going to live with this at least until we have vaccination, and it spreads easy. It spreads much easier than the flu. That's a fact, and it's more virulent than the flu, and hopefully what we've done is by doing this, we're not going to overwhelm then our medical capabilities, so that we could never contain it. All we could do is try and tamp it down so that we could keep it in check, at least where we weren't sitting like Italy, where they were overran and they just had to start deciding who got to live and who got respirators and who didn't. So we don't want to have to do that.
I had just one last question, and I guess it really depends on where we stand. Is there any indication that they're going to open up to numbers of, let's say, 100 people in one space, possibly this year, by this fall? What are the expectations of that? And the reason I ask is because it impacts our monthly chamber luncheons, and then of course our banquet's been canceled. Yeah.
In phase 3, and this is this is as long as we don't have a setback. So every single thing on here is contingent upon a major spike. So as long as there's not that, then we have the groups of 50 people coming on in phase 3 in July. As far as the 100 people go, you know, I can't say for sure. I mean, it's speculation. Again, August is when school would start back. So that's all schools. So colleges and elementary, high schools, whatever. And we don't know what's going to happen yet on that in August. So to say when a group of 100 people can get together, it's, you know, I can't even make a real guess, to be honest with you. I wish I could, but you know, I don't know. We're really unsure ourselves of how things are going to go down the road. Like you said, if we had that crystal ball, but we don't. So
Yeah.
It likely won't be before August. I know that the Department of Education has asked the schools to prepare for possible later starts for the school year and everything too. So they actually have directives, I think, to do 3 different start dates, one early and one regular, and then one postponed start date. So they're just looking at all sorts of options for how they're going to be able to operate, I think, next year. So, you know, the 100 gatherings, that's a school cafeteria, you know, at a normal lunch. So I don't know how they could go back until we're at at least the 100 people gathering phase of all of this.
Oh, I had one last question, and then I'll let somebody else kind of jump on here. For some of the businesses, I know that there have been, you know, some companies are talking about doing temperature checks, especially with larger number of employees. Is there any thoughts on a possible procedure for that? I'm thinking of, you know, how that would look as far as, I mean, I guess you could do I don't know, the Rolly type thermometer, but then again, that's going to take a lot of time to do. Is there any thoughts on those type of things if a certain organization wanted to implement something like that?
Well, actually outlined in the minimum requirements, all businesses that are starting back are going to have to be doing temperature checks on employees, and it's actually 2 steps. It's a temperature check and a health screening is how it's listed. So the temperature checks are preferred to be done with no-touch thermometers, the infrared, the gun type, you know, that you can just kind of shoot a dot in the middle of their head. If you don't have those, then it can be done at home. The regulations are written in such a way that it allows for the employees to do those temperatures on themselves at home and then report that at work. So, and the same thing with the health screening. So, you know, the screenings are just basically 2 or 3 questions that you would ask about: have you had a fever? Do you have any signs or symptoms? Are you feeling well and healthy? You know, those kinds of general wellness questions.
So the business is going to be able to, they've got a little flexibility there in how they decide to set that up. One business may say, you know, no way, we're not going to trust it. Our employees are going to get temperature screened here. And another business may say, you can take your temperature at home and report it, self-report it to us, and we're going to keep that log right before you come in. So, you know, they have a way to do that either way. And then, of course, if an employee becomes ill during the workday, then they're going to have to go ahead and go home. And I think, let's see, if they become work during the workday, then even businesses need to be able to know that they have a way to get an employee tested. So, and there's testing sites in our counties. And when I say testing site, I don't want to make that sound like that some of these places are just open to come one, come all, we're testing like crazy. You know, it's some of them are not like that. It's more like if you went to your doctor and they test their regular patients, they're able to do that. They're still a testing site. So.
I'm sorry, go ahead.
Sorry, Ellen, let me say this while I'm bringing it. Every county has at least one testing location. Most have 3 or 4 at least. Some have multiple. So I would always encourage employers to tell their employees to check with their local provider, whoever their family practice person is. Check with them and see if they can do their testing there. And if not, places like after hours clinics and quick cares and urgent cares and those type of places, generally across the 10 counties are doing testing. So that would be a next alternative. Go ahead. I'm sorry to interrupt.
Okay. No, that's all right. My question was about the thermometers. Where can the business people get the thermometers that are the non-touch type things like we were talking about?
Very good question. They are in extremely
Yeah, we're not having any luck.
yeah, they are in extremely short supply. And if a business thinks that they need them, they probably need to go ahead and identify a vendor, whether it's Amazon or Walmart or someplace, and get it on order, because a lot of the places
Okay.
are already back ordered for those things. So if that's something they want to purchase and they know they need it, then go ahead and order it. And it may say it's going to be shipped the end of May, but in all actuality, that may come in a week or two. And until that arrives, if the business wants to make that their policy that they're going to do screenings in person as the employees arrive, until that happens and they get their equipment, they could have the employees report from home, check their temperatures at home, and then modify their policy or something later if they need to when they get their equipment. But you do definitely encourage them to have a plan.
Okay. Now, these plans, because I know before they were saying that they did not have to be turned into the governor's website there, but just to be coming up with a plan. Who sees these plans, or does anybody know about these plans, or do we just not have to worry about trying to monitor that as a chamber?
Yeah. I think right now what's happened is the plans have been, the general plan is out there as far as the guidance goes. And as long as you meet that guidance, you can't go below it. You can go above it, of course, if you want to, but as long as you meet that guidance, then you don't have to have a plan reviewed. A lot of people are choosing to just kind of run it by us. And every plan that we saw, for the most part so far, have been really great plans. And with maybe just a couple of minor little tweaks is all they needed. So, but no, they don't have to submit their plans to the health department. There's not near enough of us to go through all the plans of all the businesses out there. So that would be an overwhelming amount of work for us. If they do have questions, they can certainly reach out to us, reach out to any one of our environmentalists or planners in each county. So each county, we have somebody there that is, a fair expert on these. We're all becoming fair experts on these. So, and we have our enforcement people out in every county, so they'd be able to help with that. One other thing I want to say, I talked to our director of nursing on thermometers. She advised to check with local pharmacists, and they may be able to help to track down some thermometers.
Okay, thank you.
Ellen, I'll say too that I know what you're talking about the plans, and the state is asking people to maybe submit those virtually on their Healthy at Work page. There's a link where they can say, upload your plans here, kind of a thing. And I think what they're doing with those, they're using that to create the guidance.
To make the guidance. Yeah.
Yes. Take everybody's best ideas and put them all together. So it's not that we have to approve everything. It's just really they're trying to pick everyone's brains and see what's the best practices for everyone that they can share across the state.
Yeah, that's the way I'd understood it too. I was just making sure that we weren't supposed to do, when y'all were talking about the plan and stuff, to just make sure nothing had changed there. Okay, thank you. I appreciate it.
So you don't have to have your individual business's plan approved. That would be, the state, again, there's not enough people up there that they can even
to do it all.
Like that. So, but what Amy said, they're using it to create the guidance. So they have taken input from the businesses.
Okay, thank you. Is there anything else from anyone, Sherry? I don't think I've given you a chance to talk yet. Can you hear me?
I can hear you. I don't have anything. Thank you.
Okay, appreciate that. All right, we'll just reiterate again, thank you all very much for joining us today, and we are willing to do these types of calls with your local chamber groups if that's something that you think would be helpful. We can set those up. We have Zoom capacity like this we can use, or if you all want to set up the meeting and just invite us, we can join with you all ever how is most beneficial in your local communities. So, Mr. Crabtree or Stewart, do y'all have any closing comments?
So if you do want to set up a Zoom meeting for your county, then, you know, it might be a way that we could get several different business types on there at once and be able to answer questions at once. Of course, we can record these. So after that, any members that couldn't attend the meeting, you could send them the link and they could watch the recording. So, but again, like Amy said, if you'd like to do that, we'd be more than happy to. What we would like to do is any kind of issues that may come up, we want to try and deal with as much of those up front as we can before they get going and it becomes much harder to put something in place while they're operating. So if we could do it up front, hey, we're all for that.
Only thing I'll say is just thanks for joining us and supporting us and cooperating, and we're as anxious as everyone else for COVID-19 to be in the history books.
Thank you all very
Yeah.
much for this opportunity today. I really appreciate you all, answering our questions and, making this, possible for today. Really appreciate it.
You all are
Yeah, me
welcome.
too.
Have a great weekend.
You too.
Thanks.